Hey there. If you've ever stared at a prenatal ultrasound report, you know it can bring this incredible wave of joy, but sometimes it can also bring a whole lot of stress. So today, we're going to dive into what those numbers are really telling you, and maybe more importantly, what they're not. And let's be real, it's totally unsettling when phrases like less than the fifth percentile or this giant estimated fetal weight pop up on a report. It can feel like you're just watching numbers on a page instead of your baby. And look, that anxiety is completely valid. But here's the thought. What if these numbers are really more like well-informed estimates than they are cold hard facts? Okay, let's get into it. First things first, we need to completely reframe how we think about this technology. Let's think of it less like a super precise digital scale and more like a window that gives us an amazing view, but it's not always crystal clear. And this is really the most important thing to get. An ultrasound is not a scale. It doesn't actually weigh your baby. It's using some pretty complex math to give an approximation, not an exact down-to-the-ounce measurement. And we're not talking about a tiny margin of error here. The American College of Obstetricians and Gynecologists, that's ACOG, they acknowledge it can be off by plus or minus 10 to 15% in the third trimester. Think about that. For an 8-pound baby, that's a potential swing of a full pound in either direction. That's huge. So that kind of brings us to what I call the fetal weight guessing game. It's why you can have 2 different scans, sometimes just a couple of days apart, and get 2 very different results. And it all comes back to this fundamental idea. The machine is essentially doing a high school geometry, not hopping on a bathroom scale. It's measuring shapes and sizes and then calculating an estimate based on those measurements. And the main tool they use for this math problem is something called the Hadlock equation. It's a formula that's been around since the 80s, and it takes a few key measurements and crunches them to come up with that estimated fetal weight. So how's it work? Well, it's basically a 3-step process. First, the technician measures the baby's head, their abdomen, and their femur bone. Step 2, those numbers get plugged into the Hadlock equation. And step 3, it spits out that final estimated weight. But here's the real kicker. That abdominal measurement, it's the hardest one to get right, and it has the biggest impact on the final number. A tiny little difference there can create a big change in the weight estimate. And you know, it gets way trickier to get a perfect measurement later in pregnancy. Why? Well, for one, the baby's position might be hiding what the tech needs to see. There's less amniotic fluid, which kind of clouds up the picture. And then you've got things like fetal fat and even the mother's own tissue that can blur the lines, often making that all-important belly measurement seem bigger than it is. Okay, check out this real-world case. It perfectly shows how wild this can get. On day 1, an ultrasound at the OB's office estimated 7 pounds, 12 ounces. Just 48 hours later, a specialist, an MFM, did another scan and estimated the baby was likely over 9 pounds. What a difference, right? And the actual birth weight? 8 pounds, 2 ounces. Smack dab in the middle. It just proves how different techs, different machines can give you totally different answers. And that leads us right into one of the biggest sources of stress for so many people, the big baby false alarm. Let's talk about why a diagnosis of macrosomia is wrong so often. Just take a look at this. When an ultrasound predicts a big baby, it turns out to be a false alarm about 60% of the time. Let that sink in for a second. The prediction is actually more likely to be wrong than it is to be right. To put it another way, based on data from ACOG, at least half of all the babies that get labeled very large on an ultrasound go on to be born at a completely average normal weight. But, and this is super important, here's what ultrasound is amazing at. When it comes to ruling out a big baby, its accuracy is over 90%. So if the scan says your baby is not macrosomic, you can feel really, really confident about that. It's just much better at telling you what's not there than confirming what might be. All right, let's switch gears and tackle another really common point of anxiety, decoding the short femur measurement. This is one of those places where context is absolutely everything. So on one hand, you have this kind of scary, isolated data point, femur less than the 5th percentile. But on the other hand, you have the full picture that a specialist is looking at. They're seeing your low-risk genetic screens, they're considering your family's genetics, like, hey, how tall are the parents? And they're even thinking about how the baby was curled up during that specific scan. And a lot of the time, this comes down to something called being constitutionally small. Now, this is not a disorder. It's just a totally normal genetic growth pattern. It's actually more common in families with Asian heritage or just people with smaller frames in general. Why? Because a lot of the growth charts we use are still based on older data from mostly Caucasian populations. And hey, don't just take my word for it. The Society for Maternal Fetal Medicine says it pretty clearly right here. When all your other genetic screening is low risk, one isolated short femur measurement doesn't usually mean you need to do more invasive testing. All those other data points provide that crucial, reassuring context.
So where does all of this leave us? Well, the big takeaway is that statistics are not destiny. And really understanding that can help you have a much more confident and way less stressful journey.
And this is especially important for intended parents on a surrogacy journey to hear. A baby's skeletal size and their proportions, that stuff is overwhelmingly decided by genetics. It's not a reflection of the surrogate's diet or their lifestyle, it's just genetics at play. And really, if you remember just one thing from all of this, let it be this. Percentiles describe population statistics, not individual destiny. Your baby is an individual, not just another data point on a population chart. So let's just recap the key takeaways here. First, ultrasound reports are approximations. They're not crystal ball predictions. Second, the trend over time across multiple reports always matters more than a single snapshot. And finally, context is everything. Genetics, other screenings, even the baby's position. It all matters. So I want to leave you with this question. Now that you know all this, the limitations, the context, the whole shebang, how can you use this new understanding to reframe the conversation around your next ultrasound and feel more empowered as you move forward?